Hi, I'm Dr. Ray Foxworth, and I'm sitting here today with Dr. Tom Augat. We have been friends for a number of years, and I really want the profession, as I said earlier, to see some of the unsung heroes that are helping them in ways that they don't even know about. And I want to put a face with the clinical compass. So how long have you been in practice?
30 years, Ray.
I know you've served in multiple positions. How did you find out about the clinical compass and become involved with it?
I was state president for Maine, and at that time I was at a COXA meeting, and I just happened in on a CCGPP meeting, which was the initial name of this group, and very interested in what was going on, and I was asked to become part of it. I had a little bit of an unusual background. 30 years ago, we didn't talk that much about research in chiropractic, but I actually, at Palmer, got an honors in research, which was, so it was going on, you know? And so I had that background and very interested in it and wanted to be able to pursue it to help the profession.
You know, one of the things that I think has been most impressive recently is, I think a lot of people are familiar with the United Healthcare issue where they issued a policy they weren't going to pay for treatment of headaches for chiropractic. And literally in 30 days' time, we turned a ship around that years ago would have taken probably legislative efforts, would have taken years to make that happen. And probably most chiropractors in the nation don't even know that happened.
I hope they come to know that, because that's the most recent and probably the largest victory that we've been involved with. But that rapid response team has been busy through the years, and we've been called in many cases, often on a state level, a regional level, where an insurer or another entity has cited so-called research or facts. And when you bring out the actual research, which we've so painstakingly combed through, it always trumps what they have.
Right.
And I think the average doctor doesn't realize the power of science if they can harness it and use it to bolster and support what they do. But when we get out there, people go, well, you're not scientific. And they love to try to use that against us in court or in an insurance situation,
right,
and say that, well, you know, you're not trained to do this, or there's no science to this. There is.
You're on the elevator with a doc. What would you tell him? What would be the most important reason that they should contribute and help support the clinical compass?
We are their support system if they get into a situation where they're told they can't do something, or they don't know how to do something, or there's no science behind something. We're the go-to for that. And to protect your right to be able to practice what you've learned and what we all know provides fantastic results for patients. Why would you not? Why would you not do that? And do so at usually a pretty healthy level.
It was interesting today in our meeting, we were doing some math and realized that turnaround of that policy, and I don't remember what the number was, but it was in the millions of dollars
per month
that chiropractic got paid
or
because of the or would not have been paid had it not been for the clinical compass.
Absolutely.
So on behalf of those docs, thank you, and I appreciate the work that you do.
Thank you, and thank you for all your help.
You bet.
Fantastic.